I'm Rick Feinstein. I run 42 marathons, including 36 in New York. I had slow AFib. In the beginning, it was when I first started running, I'd get like to my next door neighbor's house and feel really tired. I'm a Marine, so I would push through it. At some point, about 5 or 6 years ago, it became persistent AFib. I had a cardiac arrest, and they put in a pacemaker and defibrillator. In going through the normal heart tests, they determined that I had a leaky tricuspid valve and that it was causing heart failure. Part of the reason was the wire from my defibrillator was impinging on the flap of the tricuspid valve.
In the past, the only way to address tricuspid regurgitation was with an open surgical procedure. Fortunately, new technology allows us to either repair or replace the tricuspid valve via a catheter in a minimally invasive procedure.
He became our first implant of the Evoke transcatheter tricuspid valve replacement system, which was FDA approved around the spring of 2024 for patients with severe tricuspid regurgitation.
Unlike open heart surgery, where the surgeon's able to actually visualize the tricuspid valve and visualize where they're able to go, this procedure is guided by X-ray, but really mostly by live three-dimensional imaging. We're able to visualize the valve itself as it enters the right side of the heart, and it goes within the native tricuspid valve.
So what we did in Mr. Feinstein's case, I was able to safely remove the lead that was crossing the valve, freeing it up for Dr. Rutkin and his team to be able to come behind and replace the valve. We leveraged the expertise of our structural heart doctors, our surgeons, and our electrophysiologists to really take a team approach to these patients.
Since my surgery, I'm back to doing what I did, just feeling good. I run 3 times a week, I swim 3 times a week, push-ups, sit-ups, crunches, as I like to say, once a Marine, always a Marine.
There's nothing we love more than taking a patient who is accustomed to a certain very high level of function. Here we have a marathon runner and help them restore the quality of their life and get back to the lifestyle that they were accustomed to living.
I would have to say my overall experience at Northwell Health was, in a word, perfect. This was the most coordinated team. Everybody had my best interests at heart, no pun intended, and it was a unique experience for me, one that I really appreciate.